Hi, I'm Dr. David Rosenhan, and I conducted a provocative study of mental hospitals to answer two major questions. One, are mental health professionals able to distinguish between the mentally ill and the mentally healthy, and what are the consequences? I also questioned whether the characteristics that lead to psychological diagnosis reside in the patients themselves or in the situations and contexts in which the observers find the patients.
Rosenhan recruited 8 participants to serve as pseudo-patients. All participants were given the same instructions. Each one was to call the hospital and make an appointment. Upon arrival at the hospital, they complained of hearing voices that said empty, hollow, and thud. Other than that one symptom, all participants acted normal and gave truthful information to the interviewer. After the interview was completed, all participants were admitted to the hospital, except for one that was admitted and diagnosed with schizophrenia. Once in the hospital, the participants dropped the pretend symptoms and behaved normally. No one knew when they would be released, but it was up to each participant to get themselves released by convincing the hospital staff they were mentally healthy. Each participant kept a journal of their experiences. At first, they tried to hide it, but the staff overlooked it as another symptom. Medication was administered to all patients. Whether they were a pseudo-patient or real patient, everybody was given the same dosage. At the end, all patients threw their medication that was given to them down the toilet and flushed them away.
Contact among the patients, whether pseudo-patients or not, and the staff were minimal and often bizarre. Any attempt of contact with various staff members was usually responded with them moving on and averting their eyes from the patients.
For the results, the length of stays at the hospital for the pseudo-patients ranged from 7 to 52 days, with an average of 19 days. The key finding, however, was not that the real patients were able to identify who the pseudo-patients were, but the fact that when the pseudo-patients were released, their health status in the medical records was recorded as schizophrenia in remission. This study demonstrated that even health professionals often can't tell the normal from mentally ill in a hospital setting. The hospital setting had a great influence over the hospital staff in dehumanizing the patients because they were in a psychiatric hospital.
After the discovery that population in mental hospitals decreased and the increase of antipsychotic medication was used to help patients be able to leave and live close to normal or fully normal lives. It also boosted the growth of community mental health facilities, crisis intervention centers, and behavior therapies that focused on specific problems and behaviors that avoided labels.
I think you're crazy.